Question number 101. A 2-year-old boy fell off his tricycle and hurt his arm. He got up to start crying, but before there was any sound, he went pale, unconscious, and rigid. He recovered after 1 to 2 minutes but remained pale. After an hour, he was back to normal. His mother says she was afraid he was going to die and that he had similar episode 3 months prior after falling down. Some steps. What single investigation is indicated? Option A CT head, option B EEG, option C CBC, option D none, option E skeletal survey. So the correct option here is option D none. Question number 107. A 5-month baby present with recurrent vomiting. Mother noticed some of the vomitus is blood stained. Choose the single most likely investigation. Option A upper GI endoscopy, option B barium meal, option C ultrasound, option D colonoscopy, option E CT abdomen. So the correct option here is option A upper GI endoscopy. Question number 108. A 76-year-old is treated with hypertension. He suffers from pain and redness at MTP joint of his right big toe. Which of the following anti-hypertension cause these symptoms? Option A losartan, option B bendroflumetazide, option C ramipril, option D bisoprolol, option E verapamil. So the correct option here is option B bendroflumetazide. Question number 109. A 33-year-old male involved in a street fight presents with bruises and deformity in the upper part of his leg. X-ray shows fracture of the neck of fibula. What is the single most associated nerve injury? Option A sciatic nerve, option B gluteal nerve, option C musculocutaneous nerve, option D lateral peroneal nerve, option E tibial nerve, option F femoral nerve. So the correct option here is option D. Option D lateral peroneal nerve. Question number 110. A 35-year-old man presents with history of dyspepsia. H. pylori antibodies are negative. No improvement is seen after 1 month of treatment. What is the next step? Option A urea breath test, option B gastroscopy, option C CT, option D MRI. So the correct option here is option A, option B gastroscopy. Question number 111. A 15-year-old male has bilateral ankle edema. His blood pressure is 110/70 mmHg and urinalysis shows protein positive. What is the most likely diagnosis? Option A HUS, option B IgA nephropathy, minimal chain glomerulonephritis. Question number 112. A 28-year-old man has developed red raised rash on trunk after playing football. His past medical history shows he had childhood asthma. The rash is becoming increasingly itchy. What is the most appropriate treatment? Option A oral chlorpheniramine, option B oral amoxicillin, option C IM adrenaline, option D nebulized salbutamol, option E histamine. So the correct option here is option A oral chlorpheniramine. Option A oral chlorpheniramine. It is the correct option here. Question number 113. A 72-year-old man has been advised to have antibiotic prophylaxis for some years now before dental treatment. He has never experienced chest pain. 3 weeks ago, he noticed breathlessness on exertion, and for 1 week, he had orthopnea. His pulse is normal. What is the most probable diagnosis? Option A aortic regurgitation, option B ischemic mitral valve, mitral regurgitation, option C mitral valve prolapse, option D pulmonary stenosis, option E mitral valve stenosis. So the correct option here is option E mitral valve stenosis. So correct option is option E mitral valve stenosis. Question number 114. A 37-year-old woman presents with fatigue Exam angular stomatitis, no chylonychia. Choose the single cell type you will find on the blood film. Option A macrocytes, option B microcytes, option C granulocytes without blast cells, option D blast cells. So the correct option here is option A macrocytes. Question number 115. A 4-year-old boy with a febrile convulsion lasting 8 minutes has been given IV lorazepam to control them. What is the single most likely serious side effect? Option A amnesia, option B anaphylactic shock, option C apnea, option D bronchospasm, option E cardiac arrhythmia. So the correct option here is option C apnea. It is the side effect. Question number 116. A 4-week girl has been diagnosed of having breast milk jaundice. She is otherwise well. What is the single most appropriate management? Option A continue breastfeeding, option B exchange transfusion, option C increase fluid intake, option D phototherapy, option E stop breastfeeding. So correct option here is option A continue breastfeeding. It is the correct option here. Question number 117. A 12-year-old girl, when playing in the garden, accidentally stepped on a hive and was bitten several times. She has numerous wheals on her body and complains of severe itching. What is the single most appropriate management? Option C, IM adrenaline, option D, oral ciprofloxacin, option E, reassurance. So the correct option here is option C, IM adrenaline. Question number 118. A term baby born to a 30-year-old woman of blood group A negative develops severe jaundice within first 24 hours of birth. What is the most likely diagnosis? Option A, hereditary spherocytosis, option B, G6PD, option C, ABU incompatibility, option D, RH incompatibility, option E, physiological jaundice. So the correct option here is option D, RH incompatibility. Question number 119. A 4-year-old girl is found to have bounding pulse and continuous machinery murmur. What is the most probable diagnosis? Option A, tetralogy of flow. Option B, atrial septal defect. Option C, ventricular septal defect. Option D, patent ductus arteriosus. Option E, COA. A 4-year-old girl with bounding pulse and continuous machinery murmur. So the correct option here is option D, patent ductus arteriosus. Question number 120. A 12-year-old child with episodes of sudden bluish discoloration and brief loss of consciousness, exam clubbing, central cyanosis, systolic thrill with systolic ejection murmur in second left intercostal space. What is the most probable diagnosis? Option A, tautology flow. Option B, atrial septal defect. Option C, ventricular septal defect. Option D, patent ductus arteriosus. Option E, COA. So the correct option here is option A, tautology flow. Question number 121. An 8-year-old child who is tall for his age and a refractory error for which he wears glasses has presented with severe crushing chest pain. What is the most likely diagnosis? Option A, Fragile X syndrome. Option B, Prader-Willi syndrome. Option C, DiGeorge syndrome. Option D, Marfan's syndrome. So the correct option here is option D, Marfan's syndrome. Question number 128. 122. A 4-year-old child presents with pain of spontaneous onset in his knee for 2 days duration. He has developed a mild fever in the second day. He can walk but has limp, exam painful restriction in the right hip. What is the most probable diagnosis? Option A, osteosarcoma. Option B, septic arthritis. Option C, TB arthritis. Option D, exostosis. Option E, osteomyelitis. The correct option is option B, septic arthritis. Septic arthritis is the correct option here. Question number 123. A man with anterior resection and end-to-end anastomosis done complains of severe pain in the chest and abdominal distension. What is the most appropriate investigation likely to reveal the cause? This deterioration. Option A, X-ray abdomen. Option B, exploratory. So the correct option here is option C, CT. Question number 124. A patient with history of alcoholism, ataxia, hallucination, and loss of memory. He is given a camprosate. What other drug can you give with this? Option A, chlordiazepoxide. Option B, thiamine. Option C, diazepam. Option B, disulfiram. Option E, haloperidol. So the correct option here is option B, thiamine. Question number 125. A 35-year-old male builder presented with sudden onset of severe abdominal pain. He was previously fit and well, other than taking ibuprofen for long-term knee injury. On examination, he is in severe pain. Pulse is 110, blood pressure 110/70, and has rigid abdomen. What is the most likely diagnosis? Option A, biliary peritonitis. Option B, ischemic colon. Option C, pancreatic necrosis. Option D, perforated diverticulum. Option E, perforated peptic ulcer. So the correct option here is option E, perforated peptic ulcer. It is the correct option here. Question number 126. A woman 5 days post-op for bilateral salpingo-oophorectomy and abdominal hysterectomy has developed abdominal pain and vomiting along with abdominal distension and can't pass gas. No bowel sounds heard, although well hydrated. What is the most appropriate next step? Option A, X-ray abdomen. Option B, exploratory laparoscopy. Option C, CT. Option D, ultrasound. Option E, barium. So the correct option is option A, X-ray abdomen. Question number 127. A 30-year-old man complains of hoarseness of voice, exam, unilateral immobile vocal cord. What is the most probable diagnosis? Option A, Graves' disease. Option B, hematoma. Option C, unilateral recurrent laryngeal nerve injury. Option D, external laryngeal nerve injury. Option D, trichomalacia. So the correct option here is option C, unilateral recurrent laryngeal nerve injury. Question number 128. A 38-year-old woman has delivered after an induced labor which lasted 26 hours. Choose the single most likely predisposing factor for postpartum hemorrhage. Option A, atonic uterus. Option B, cervical vaginal trauma. Option C, ruptured uterus. Option D, fibroid uterus. Option E, age of mother. So the correct option here is option A, atonic uterus. Question number 129. A 32-year-old woman in tears describing constant irritability with her two small children and inability to relax. She described herself as easily startled with poor sleep and disturbed nightmares following a house fire a year ago while the family slept. What is the single best treatment? Option A, reassurance. Option B, relaxation therapy. Option C, quetiapine. Option D, lufpramine. Option E, fluoxetine. Correct option is option E, fluoxetine. Question number 130. A 22-year-old woman with long-standing constipation has severe anorectal pain on defecation. Rectal exam impossible due to pain and spasm. What is the most probable diagnosis? Option A, anal hematoma. Option B, anal fissure. Option C, anal abscess. Option D, protalgia fugax. Option E, hemorrhoids. So the correct option here is option B, anal fissure. Question number 131. A 20-year-old student attends the OPD with complaints of breathlessness on and off, cough and sputum. His sleep is disturbed and skin is very dry in flexural areas of the body. Exam tachypnea, hyperresonant percussion, and wheezing. On auscultation, what is the most likely diagnosis? Option A, extrinsic allergic alveolitis. Option B, asthma. Option C, Wegener's granulomatosis. Option D, COPD. Option E, cystic fibrosis. So the correct answer here is option B, asthma. Question number 132. A patient with thought disorder washes hands 6 times each time he uses the toilet. What is the best management? Option A, psychodynamic therapy. Option B, CBT. Option C, antipsychotics. Option D, refer to dermatology. Option E, reassure. So the correct option here is option B, CBT. Question number 133. A 25-year-old woman presented to her general physician on a routine checkup. Upon vaginal exam, she was fine except for finding of cervical ectropion, which was painless but mild contact bleeding on touch. What is the next management? Option E, endometrial ablation. Option B, cervical smear, second line. Option C, colposcopy. Option D, antibiotics, first line. Option E, vaginal ultrasound. Option F, pack with gauze and leave to dry. So the correct option here is option B, cervical smear, second line. Question number 134. A 32-year-old had a normal vaginal delivery 10 days ago. Her uterus has involuted normally. Choose the single most likely predisposing factor for PPH. Option A, retained product. Option B, DIC. Option C, uterine infection. So the correct option here is option C. So the other option D, von Willebrand disease. Option E, primary PPH. These are incorrect. Question number 135. A 37-year-old man slipped while he was walking home and fell on his outstretched hand. He complains of pain in the right arm. X-ray showed fracture of the head of radius. What is the single most associated nerve injury? Option A, radial nerve. Option B, musculocutaneous nerve. Option C, median nerve. Option D, ulnar nerve. Also the correct option here is option A, radial nerve. Question number 136. A butcher stabbed accidentally his groin. He bled so much that the towel was soaked in blood and blood pressure is 80-50 mmHg. Pulse is 130. What percentage of circulatory blood did he lose? Option A, less than 15%. Option B, 15 to 30%. Option C, 30 to 40%. Option D, 40 to 50%. Option E, more than 50%. So the correct option here is option C, 30 to 40%. Question number 137. A 67-year-old man presents with palpitation. ECG shows an irregular rhythm, heart rate 140 beats per minute. He is otherwise stable. Blood pressure 124 over 80 mmHg. What is the most appropriate management? Option A, bisoprolol. Option B, ACE inhibitor. Option C, ramipril. Option D, digoxin. So the correct option here is option A, bisoprolol. Question number 138. A 78-year-old man is depressed after his wife's death. He has been neglecting himself. His son found him in a miserable state. When he went to visit, the son can't deal with his father. What is the most appropriate management? Option A, voluntary admission to psychiatric ward. Option B, hand over to social worker. Option C, request son to move in with father. Option D, send patient to care home. So the correct option here is option A, voluntary admission to the psychiatric ward. Question number 139. An old alcoholic presents with cough, fever, bilateral cavitating consolidation. What is the most probable cause? Option A, gram-positive diplococci. Option B, coagulase positive cocci. Option C, gram-negative cocci. Option D, AFP. Option E, coagulase negative cocci. So the correct option here is option B, coagulase positive cocci. Question 140. A 67-year-old man had successful thrombolysis for an inferior myocardial infarction 1 month ago and was discharged after 5 days. He is now readmitted with pulmonary edema. What is the most probable diagnosis? Option A, aortic regurgitation. Option B, ischemic mitral regurgitation. Option C, mitral valve prolapse. Option D, pulmonary stenosis. Option E, rheumatic mitral valve stenosis. So the correct option here is option A. So the correct option here is option B, ischemic mitral regurgitation. Option B is correct. It is ischemic mitral regurgitation. Question number 141. A 60-year-old lady who had a stroke 3 years ago now reports having increased dyspnea on exertion and atrial fibrillation. Chest X-ray straight left border on the cardiac silhouette. What is the most probable diagnosis? Option A, aortic regurgitation. Option B, ischemic mitral regurgitation. Option C, mitral valve prolapse. Option D, pulmonary stenosis. Option E, rheumatic mitral valve stenosis. So the correct option here is option A, rheumatic mitral valve stenosis. It is the correct option. Question number 142. A 60-year-old diabetic complains of pain in thigh and gluteal region on walking up the stairs for the last 6 months. She is heavy smoker and has ischemic heart disease. What is the most appropriate diagnosis? Option A, thromboangiitis obliterans. Option B, sciatica. Option C, DVT. Option D, atherosclerosis. Option E, embolus. So the correct option here is option D, atherosclerosis. Question number 143. A 3-year-old child who looks wasted on examination has history of diarrhea on and off. The mother describes the stool as bulky, frothy, and difficult to flush. What is the single investigation most likely lead to the diagnosis? Option A, sweat chloride test. Option B, anti-endomysial antibodies. Option C, LFT. Option D, ultrasound abdomen. Option E, TFT. So the correct option here is option B, anti-endomysial antibodies. Question number 144. A 45-year-old woman has had severe epigastric and right hypochondrial pain for a few hours. She has a normal CBC, serum ALP is raised, normal transaminase 3 months ago. She had cholecystectomy done. What is the most appropriate investigation? Option A, ultrasound abdomen. Option B, ERCP. Option C, MRCP. Option D, CT abdomen. Option E, upper GI endoscopy. So the correct option here is option B, ERCP. It is the correct option. Question 145. A 53-year-old woman presented with pain in the eye, blurry vision, and clumsiness for 3 months. She has history of difficulty in swallowing and weakness in her right upper limb 2 years ago. What is the investigation of choice? Option A, CSF analysis. Option B, EEG. Option C, EMG. Option D, MRI brain. Option E, visual evoked response test. So the correct option here is option D, MRI brain. It is the correct option. Question number 146. A 55-year-old male presents with malaise and tardiness, exam, spleen approaching, RAF, no lymphadenopathy. Choose single cell type. Option A, helmet-shaped cell. Option B, granulocyte without blast cells. Option D, blast cells. So the correct option here is option C, granulocyte without blast cells. Question number 147. A 6-year-old patient comes with easy bruising in different places when she falls. CBCW BC 25, HB 10.9, platelet 45. All banal test positive. What is the most likely diagnosis? Option A, glandular fever. Option B, ITP. Option C, trauma. Option D, NAI. Option E, septicemia. So the correct option here is option A, glandular fever. Question number 148. A 41-year-old woman who has completed her family has suffered from extremely heavy periods for many years. No medical treatment has worked. She admits that she would rather avoid open surgery. After discussion, you collectively decide on a procedure that wouldn't require open surgery or general anesthesia. Select the most appropriate management for this case. Option A, endometrial ablation. Option B, hysterectomy. Option C, fibroid resection. Option D, myomectomy. Option E, uterine artery embolization. So the correct option here is option A, uterine artery embolization. Question number 149. A girl with history of allergies visited friend's farm. She got stridor, wheeze, and erythematous rash. What is the most appropriate treatment? Option A is 0.25 ml IM adrenaline. Option B is 0.25 ml PU adrenaline. Option C 0.25 ml IV adrenaline. Option D IV chlorpheniramine. So the correct option is option A 0.25 ml IM adrenaline. Question number 150. A 5-year-old boy is referred to the hospital and seen with his father, who is worried that he has been listless. He is not sure why his GP suggested he should come to the emergency department and is keen to get some tablets and go home. Exam, tired and irritable, swelling around eyes, renal biopsy remarkable for podocyte fusion on electron microsite. What is the most probable diagnosis? Option A, NA. Option B, myelodysplastic disease. Option C, HSP. Option D, membranous glomerulonephritis. Option E, minimal change, glomerulonephritis. So the correct option here is option E, minimal change, glomerulonephritis. It is the correct option.